Hi everybody, my name is Jessica Levac, and I'm the author of Embracing Birth, a collection of inspiring birth stories, and I'm a childbirth doula, which is a birth assistant, and today we're going to be showing you some positions to encourage a baby who's facing head down, but they're facing your belly button. That's called occiput posterior. We want to get that baby to turn and face your spine. This will make your labor shorter and more enjoyable. This position is the main reason women experience back labor, so it's a good thing to keep in mind with these positions we're going to be doing to encourage that baby to turn towards your spine and have a good, satisfying birth. Alright, so I want you to have fun with these positions and try to relax. The more you relax and have fun, the better it will be. Okay, so let's get started. The first one, we're going to be using the birth ball.
Okay, so you're just going to get on your hands and knees with the ball, and you're just going to hug the ball. And you can also rock gently on the ball.
That's a wonderful position, even if you're not having back labor. Next, we're going to need a chair.
Okay, so this position is called the lunge. Standing and facing forward, place a chair beside you. Place one foot on the chair seat with your knee and foot pointing to the side while you remain facing forward. Remaining upright, slowly lunge or lean sideways toward the chair so that you bend the knee of the leg on the chair. You should feel a stretch on the inside of both thighs. Stay in the lunge for a slow count of 5 and then return upright. Repeat during or between contractions. And if you know the baby's position, lunge toward the side where his or her back is. And if you don't, just try lunging in each direction and find a direction that's most comfortable.
Great.
Okay, the next one we're going to do is abdominal lifting. While standing, interlock the fingers of your hands and place them against your pubic bone. During the contractions, lift your abdomen up and slightly in while bending your knees. This often relieves back pain while improving the position of the baby in your pelvis.
Great. Some other things to try are walking up and down stairs. It's a great thing to speed up labor and get the baby in the perfect position for childbirth, along with slow dancing with your partner or your childbirth doula, and walking is just wonderful. Now get yourself some pillows. You're going to need 3 pillows for these.
Okay, so the first thing that we're going to do is called side lying. Lie on your side with both hips and knees flexed and a pillow between your knees toward which your baby's back is pointing. If the baby is left, lie on your left side. If the baby's right, lie on your right side. If direct, try either side and look for some rotation of the baby's back toward that side. Semi-prone. Lie on your side with your lower arm behind you and your lower leg straight out. Flex your upper hip and knee and rest your knee on a doubled up pillow and roll towards your front. Lie on the side that's opposite to the baby's occiput. Pelvic rocking. While kneeling and leaning forward, rock your pelvis forward and back or in a circle. This can help even if you don't know the baby's position. This helps to dislodge the baby within your pelvis and encourages rotation. Abdominal stroking. While you're on your hands and knees, your partner can reach beneath your abdomen and firmly stroke repeatedly across your abdomen in the direction the baby should rotate. So from the side of your body where the baby's back is to the other side. The stroking should feel good, and it's usually better to do it between, not during contractions. And don't do it if it's uncomfortable or you don't know the baby's position. The next one is the open knee chest position. This may help reposition the baby if used during very early labor. If you have frequent, irregular, painful contractions causing back pain and your cervix is not dilating, try this. From hands and knees, lower your head and chest down to the floor or bed. Be sure your buttocks are high in the air and your hips are open enough that your knees are further from your belly than your hips. Try staying in this position for 30 to 45 minutes. Once the baby rotates to the occiput anterior position, the back pain usually subsides.
Well, there we have it. If you have any questions at all, please send me a message at jessica@embracingbirthbook.com. And I hope these positions help you to have a safe, satisfying childbirth. Have a great birth.